Hello viewers, today our video is about very interesting and common topic. What are the side effects of chocolate? If you like our video, please subscribe our channel. Cocoa is a plant from which chocolate is made. Bitter chocolate is produced by pressing roasted cocoa kernels between hot rollers. Cocoa powder is produced by squeezing the fat from bitter chocolate and powdering the remaining material. Sweet chocolate is produced by adding sugar and vanilla to bitter chocolate. White chocolate contains sugar, cocoa butter, and milk sodium. Cocoa is mostly used for heart diseases and high blood pressure. How does it work? Cocoa contains a variety of chemicals, include antioxidant called as flavonoid. It is not clear how these might work in the body, but they appear to cause relaxation of the veins. This could lead to the lower blood pressure. This compound might also reduce the activity of chemicals in the body that promote inflammation or blockage of blood vessels. Uses and effectiveness. Possibly effectiveness for heart diseases. Some research showed that eating cocoa lowered the chances of heart diseases and death. Cocoa might have this effect by lowering blood pressure and improving blood vessels and function. High blood pressure. Most research shows that eating dark chocolate or cocoa product for 2 to 8 weeks can lower the top number in the blood pressure reading by 4 mm mercury systolic blood pressure. The bottom number, the diastolic blood pressure, is also lowered by 2 mm mercury in blood in some people with high blood pressure. Eating cocoa might also help prevent high blood pressure in people with normal blood pressure, but only if the cocoa comes from plain chocolate. Eating cocoa from dessert might increase the risk for high blood pressure. Possibly ineffective for high cholesterol. Cocoa products do not seem to improve cholesterol level in people with high cholesterol. Insufficient evidences for aging skin. Some researches shows that taking cocoa extract alone or in combination with other ingredients might improve skin wrinkles, elasticity, and roughness. Irregular heartbeat. People who eat more chocolate don't seem to have a lower risk of irregular heartbeat. Chronic fatigue syndrome. Early researches show that consuming a large amount of cocoa daily can reduce fatigue, anxiety, and depression, and increase the overall ability to function in people with CFC. Chronic fatigue syndrome. Liver scarring. Research showed that consuming a liquid meal plus dark chocolate can improve liver health in people with cirrhosis or liver scarring. Memory and thinking skills. Cocoa might improve memory and thinking skill in some people, but not all researchers agrees. The benefits, if any, may depend upon the person's age, the duration of cocoa intake, the dose of cocoa, and the difficulty of the conjunctive testing. Declining in memory and thinking skill in older people that is more than what is normal for their age. Early research showed that coca might improve memory and thinking skill in adults, may decline in thinking skill. Constipation. Early researches show that taking coca daily might soften stool in children with constipation. Diabetes. Early researches show that coca might reduce insulin resistance and improve sensitivity, but coca doesn't seem to blood sugar level, especially when used in small amount or in single doses. Heart failure. People who eat up to 250 milligrams of chocolate per week seem to have a reduced risk of heart failure. However, eating 300 milligrams of chocolate or more per week doesn't seem to be linked with a reduced risk. Abnormality levels of blood fats in people with HIV. Early research showed that eating dark chocolate for 15 days doesn't lower total cholesterol or low density lipoprotein LDL or bad cholesterol in people with HIV or AIDS. Insect repellent. Early research showed that applying coca oil to the skin reduced the black fly insect bite. High blood pressure in which only the first number, systolic pressure, is too high. Isolated systolic hypertension. Early researches show that eating 100 grams of dark chocolate is rich in coca, flavonoid, daily might slightly reduce systolic and diastolic blood pressure in elderly people with isolated diastolic hypertension. Obesity. Early research shown that following a reduced calorie diet, eating 2 squares of dark chocolate and dark sugar-free coca beverage daily for 18 weeks doesn't increase weight loss in overweight for obese individual. Parkinson's disease. Early researches show that eating 200 milligrams of dark chocolate doesn't improve movement in people with Parkinson's disease. Narrowing of blood vessels that cause proper blood flow in the limbs. Early researches show that drinking a coca beverage rich in certain chemical called as flavonoid for 6 months can increase walking distance in people with this condition. Stroke. People who eat more chocolate seems to have a reduced risk of stroke compared to those who doesn't eat chocolate. Intestinal disease, diarrhea, asthma, bronchitis, lung congestion, liver diseases, bladder and kidney ailment, preventing wrinkle, preventing stretch marks during pregnancy, other conditions, side effects and safety. When taken by mouth, eating coca is likely safe for the most people. But keep in mind that coca contains caffeine and a related chemical. Eating large amount might cause caffeine-related side effects such as nervousness, increasing urination, sleeplessness, and a fast heartbeat. Coca can cause allergy, skin reaction, constipation, might trigger migraine, headache. It can cause digestive complaints, including nausea, intestinal discomfort, stomach rumbling, and gas. When applied to skin, apply coca butter to skin is also likely safe for the most people. It can however cause rashes. Pregnancy and breastfeeding. Coca is possibly safe in pregnancy and during breastfeeding when used the moderate amount in amounts commonly found in the food, but be sure the minorities or monitor your intake. Coca is large amount during pregnancy, possibly unsafe because the caffeine is contained. Caffeine found in coca crosses the placenta. Although controversial, some evidences suggested that high doses of caffeine during pregnancy might be associated with premature delivery, low birth weight, and miscarriages. NXT. There is a concern that caffeine is large amount of coca might make NXT disorder, bleeding disorder. Coca can show bleeding clot or blood clot. Consuming a lot of coca might increase the risk of bleeding and bruising in people with bleeding disorders. Heart condition. Coca contains caffeine. The caffeine in coca might cause irregular heartbeat in some people and should be used casually in some people. Cause heartbeat condition increases.